Dr. Shannon Clark here. I am a double board certified OBGYN and maternal-fetal medicine specialist, which essentially translates into I have a certain level of expertise when it comes to pregnancy care. And what's happened over the past 24 hours? This. It is very hard for me as an expert in my field and as someone who actually cares for pregnant individuals to see this, because it's all political. It's very clear that our administration and whoever they have chosen to share their narrative or spread their narrative have no understanding of science or refuse to have an understanding of science. What they're doing is trying to get that cause in for autism, as was promised by RFK Jr. When the clock is ticking out, this is what we get. And I'm here to say, with confidence, that there is no reason why pregnant individuals should not take Tylenol when it's indicated for pain control and for fever. And as an OBGYN and MFM who is practicing and sees a lot of pregnant individuals at the bedside daily, I will continue to prescribe it for those indications. There has been no study that has found that Tylenol consumption in pregnancy causes autism or any other neurodevelopmental disorder like ADHD. The best study on this was recently published in JAMA by real experts in 2024. They looked at over 185,000 children exposed to Tylenol when they were fetuses in the uterus and found no association, definitely no causation, but no association between Tylenol use in pregnancy and the development of autism or ADHD. So these researchers actually looked at not only Tylenol, but other pain relievers taken during pregnancy and the risk for development of neurodevelopmental disorders in offspring. Then they did something called a sibling control analysis. When they did a sibling control analysis in this study, all associations went away, which lends additional credibility for a genetic cause for neurodevelopmental disorders in offspring. One of the major flaws, there are many, in studies that have shown an association is that they don't control for confounders in study subjects or in the study design itself. Also, in any study that did show an association, the vast majority of subjects who did take Tylenol did not have children or offspring that have any form of autism or ADHD. So here we have an administration with a certain person at the head. He will go on national television as the leader of this nation. Because if he says it's true, right? If he says it's true, even though he's not a scientist, he's not a researcher, nor can he even pronounce the word acetaminophen, which is Tylenol. As physicians, and I'm speaking of physicians who take care of pregnant individuals and pregnant individuals themselves and those who are trying to conceive, let's not make ourselves more vulnerable by falling for this narrative. Because if we start believing the words that come out of non-credible individuals' mouths, we are in big, big trouble. There is still a role for science, scientific research, data, and expertise in the field when it comes to any topic that is being studied in pregnancy. Do not be afraid to take Tylenol in your pregnancy if you need it.